Hello, all. Thank you so much for joining us today. I'm so excited for this event, Reckoning with the Past and Building Trust, a conversation on the COVID vaccine in Black communities. It is absolutely my pleasure to have this event tonight, along with the great team. I think you will witness a great conversation, which is actually driven by you, the community members. So we appreciate you taking the time to join us. And actually, Dr. Naima Watson, Vice Chancellor for Diversity, Inclusion, and Civic Engagement, sends her regards. And as we move on to tonight, you will see that our goal for tonight is to address some of the issues that we are seeing in Black communities and how the COVID vaccine is viewed. We will also touch on why it is that you should consider taking it. We hope to all convince you of the importance, but not only that, to really address your concerns and questions that you may have regarding the vaccine. And more importantly, critically important, we will also be addressing the misinformation and disinformation surrounding the COVID vaccine. So with that, I would like to take the time to introduce and hear a few words from our mayor, Mayor Moran, Camden's mayor, who took office as the 48th mayor of the city of Camden on January 1st, 2018. He is proudly a lifelong resident of Camden. He is also the product of the school system and former city employee. Mr. Moran served as city council president prior to becoming mayor. He is Camden's greatest advocate, and we are proud at Rutgers Camden to call him our mayor and friend. So please, Mayor Moran, thank you so much for coming. In a few words, please.
Oh, great, and good evening, Dr. Saffold. Thank you for that introduction, and I'll make sure that I'll let Dr. Watson know you did an amazing job this evening. First and foremost, I want to say it's an honor to be part of this great forum, a very important forum this evening. Let me say welcome home to Dr. George C. Hill, a true Camdenite, a legend, just based on my research, and we're super excited that he wears Camden on his chest, and looking forward to meeting him in person. Thank you to Rutgers University, which is the center point of everything that is happening in the great city of Camden. And I can sit here and talk to you about the strides we've made in public safety and the improvements over the years, with 50-year lows, with crime and just great things with our community policing, that we're literally a model police department for this country. I can talk to you about the great city of Camden that was that once industrial might that now is centered around the eds and meds. This dialogue tonight is so important, key. It's great to know and work with Leap Academy and Rutgers, and knowing that our minority students are getting great opportunities with Naima, Dr. Watson's work in Camden, with making sure our young, Latino and African American students, young men and women, have an opportunity to prosper in the eds and meds. I can talk to you about the $3 billion+ that Camden has seen in the last 10 years of investment. You can drive around the downtown area. You can drive pretty much in every sector of the city and see some sort of development, which I call inclusive prosperity. And I've had the honor, like you introduced me to, be a lifelong resident of the city, raise my children here, always stay through the tough times and give it my all, because I truly believe in my city. I happen to be, a proud son of parents that came to Camden looking for opportunity from the island of Puerto Rico. We have the honor of knowing that we are residents, but nonetheless, we suffer the same ills and deal with the same issues that occur in the African American community as well. So we see ourselves as one, united, fighting for the cause. As mayor, I want to talk about what this pandemic has meant to our city. We are a city that perseveres. We're a city that has been working extremely hard to continue to provide services, to keep the services that our great employees provide our residents, working with our first responders, fire, EMS, police, our schools under the leadership of Katrina McCombs, and the amazing job that she's doing in trying to keep our kids in line, receiving their education through this just new to all of us virtual learning. And it's been a challenge, but nonetheless, we're working collectively. Let me say that Camden is about 77,000 residents, and we'll see what the new census numbers come out. As of this date, we have approximately over 8,000 COVID positive cases in our city that have been reported, which is about almost like 10% or a little better of our population. Out of those 8,000+ positive, we've seen about 150 deaths in our city. And why? You know, we asked ourselves why. I, as a mayor, the great corporations and medical institutions like Cooper Hospital and CamCare, is because of who we are, where we live, and what we're subject to. We have a lot of community individuals that live multiple generations in one household. We have many individuals that work in vulnerable positions during the height of the pandemic, and the spread was evident and clear. So we worked hard with Cooper Hospital, Virtual Our Lady of Lourdes, CamCare, Camden County Commissioners, which were once known as freeholders, to open up much needed test sites in the communities. And we did it in the hotspot communities, and we were able to take testing so that we can get these folks tested and know who has it and how we can contact trace and how we can help. We found folks that lost their jobs, like many people throughout this country, and found themselves in a need. And we, being a food desert, we work closely with the South Jersey Food Bank of South Jersey, farmers of the state of New Jersey, and other entities and churches that were really, really amazing in assisting us in providing, you know, daily meals for our families in the city. And you know, we're getting through it, and we're strong. And we're working collectively with all our elected officials, from Congressman Norcross to all my council members, to Booker, to Menendez, our senators, our 5th legislative team, and, you know, our friends in the private sector, nonprofit, education, and medical field that have really come together as one to address this. So where are we today? We're at a point that there is a vaccine that's available to us. And let me say, I have been vaccinated. I got both shots. It was a little challenging on the back end with the second shot, but nonetheless, I'm fine. And there are a lot of questions in our community, in the African-American community and the Latino community, about why I should or I am not going to get it. We have the underlying conditions. I include myself, with the hypertension, diabetes, and I'm sure Dr. Hill's going to hit it out of the ballpark. But because we're subject to fast foods, we're subject to all the things that we really don't need in our communities, and it's just our diet and other things, right? And we have an opportunity to get vaccinated. And let me tell you, it's a challenge. I had a call this morning with the Office of the Governor, FEMA, and others from my staff to open up an additional site so we can vaccinate, in particular, African American and Latinos that are the majority, obviously, of this city, in short order. And we're going to work with the faith base and the churches so we can get these folks. So we're going to count on ministers to get the word out and assist us. And we're going to work with everybody that's willing to work. And it's simple: get vaccinated. I rather err on the safe side and say I've been vaccinated because I want to be here tomorrow. And it doesn't, according to what I'm hearing in the medical world, you know, prohibit you from probably contaminating the virus, but it's an advantage that you most likely will not leave this earth. Yes, I can go on and talk about the social injustice. I can talk about all the battles that we have, but I'm super excited about Dr. Hill and what he's going to bring. And I'm so looking forward to meeting him in person. So once again, to the Rutgers leadership, to everyone that's on this call. I mean, Zoom has just been our life. I'm just, to be quite honest, tired of Zoom, but nonetheless, we are blessed in this time that we can still communicate. And as a city of minority folks, we are a city that perseveres. We are a city that fights. We are a city that no matter what we are dealt, we will come ahead and we will come on top. And the simple reason is because we help one another, we feed off of one another, and we work together. So
absolutely, Mayor Moran.
Thank you.
Yes.
Thank you for this opportunity. I really get passion. I had notes, but I just wanted to give you my heart.
Amen.
I wanted to give you my heart, that because when you speak from the heart, you never go wrong. And if you lived it, you can talk about it. So I am so excited about Dr. Hill and what he brings. So once again, thank you to the coordinators. Thank you to everyone that is listening. And I look forward to hearing what the doctor has. Now, if there's any information that you wish to go after, go on the city's website. And you can go on our website, and we will have all links and everything pertaining to the test sites, to the vaccine sites, and we'll be updating you. So thank you.
And we'll add that to the chat box as well. We'll make sure we add that, have the tech team add that to the chat box, please.
Yes.
Thank you so much. And don't forget with your new initiatives, vaccination sites, as assistant professor at Rutgers School of Nursing, Camden. It is our pleasure and it is our passion, under the direction of Dr. Dean Nikitas, for us to basically take part and be an active we want to actually push the initiative and help out any way that we can. So please, 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 Mayor Moran, I am asking you to please make sure you reach out to us. We are always hands on deck, and we really are making ourselves available to help out and administer vaccines as sites as much as possible. So any new sites that you need coverage, please reach out to Dean Nikitas from Rutgers Camden School of Nursing. We will be glad to work with you to get that done as much as possible. And now I'm going to introduce Dr. George Hill. Dr. George Hill is nationally respected doctor and scholar. More importantly, he is a graduate of Camden High School and a respected Rutgers alum. And actually, before we started today, we were joking around about which high school is better, Woodrow Wilson or Camden High School. So I'm always proud to see people who are graduates and they come back and they speak to the community, and he also does a lot of work in the community. In addition to all of his other accomplishments, Dr. George Hill was the first vice chancellor for diversity, equity, and inclusion at Vanderbilt University. With that said, again, thank you so much for being here, Dr. George Hill. With that said, it is our pleasure to welcome you here tonight as our keynote speaker.
Well, it's a pleasure to be able to participate. I want to mention to Mayor Moran that you really are right on target in terms of providing opportunities for vaccination in sites where the citizens, the public can come, and increasing the numbers of those sites. And I really appreciate your enthusiasm about Camden. It is quite beautiful. I've spent some time in your home country of Puerto Rico and visited medical schools there at UPR, etc. And every time I go down, I just love it. But thank you for the work that you're doing. Really appreciate it. And I remember very strongly the Woodrow Wilson Camden High School football games on Thanksgiving way back when, and we used to go every year. I think Camden won all of them, but that's not true. But it really is a pleasure to have someone with your enthusiasm associated with Camden and leading Camden. Thank you for your leadership. I think we should take a moment, and the mayor noted it, that in Camden, 150 individuals have died. As you know, 500,000 was the number that we passed in terms of deaths last evening. And could we just pause a moment and remember them and remember their families and those that they have left. Thank you. I'm sure everyone probably on the call knows someone or someone's family that's been touched. So I have 15 minutes, and I'm going to limit myself to 15 minutes. So some of the details of what you may hear will not be included, and please don't hesitate to contact me later or raise it in the chat box. So I'm going to speak then on, should I receive the COVID-19 vaccine? Next slide, please. I asked a colleague in Camden what were some of the reasons that someone that they knew was hesitant to take the vaccine, to get the vaccine. And they mentioned the reasons that the individual was hesitant. And this is what they said. I keep referring to they because they may be on the line. This is what they said. Well, there's historical mistrust. There's general disparities in health for minorities. And then they said, why should we trust anyone? Who has been looking out for us? I get it. I didn't jump at the opportunity initially. I waited for the safety data. Now, this is a comment from an individual, and it basically summarizes my talk. We must be very sensitive to valid hesitancies that individuals have. Next slide, please. In terms of the color of COVID and deaths from COVID-19, African Americans 1 in 602, Native American 1 in 625, Hispanic 1 in 709, and whites 1 in 862. So you can see that whites are lowest in terms of deaths per COVID-19 in terms of percent. Next slide, please. And this slide points that out as well, the risk of COVID by race, ethnicity, compared to white non-Hispanic persons. So African Americans are 3 times likely to be hospitalized and twice likely to be deaths, which is the same for Hispanics. And Native Americans are 4 times likely to be hospitalized and twice likely to die. Next slide, please. So this slide shows vaccination rates in terms of whites, Latinos, and Blacks. 60% of those who have been vaccinated, about 60% are white, 11.5% are Latinos, and only about 5% of those who have been vaccinated are Black. I'm sure some questions will arise about why that is, and I want to cover some of those factors. Next slide, please. Why is this vaccine hesitancy happening, and what can we do about it? Next slide. Some of you may be familiar with Dr. Harriet Washington's book, Medical Apartheid. It's a fantastic book. We do not have time to go through the details of what she has touched on, but she makes it very clear that in this country, since slavery began, medical apartheid has occurred. The book is entitled Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times, on the plantation, to the present. Next slide, please. And these are some of the medical exploitations of African Americans that she notes in her book. Medical exploitation on plantations, radiation experiments on African Americans, and the last bullet is the Tuskegee, what I call the death sentence. Next slide, please. I wanted to just point out Dr. William Jenkins. He was an African American. He died a year or 2 ago. He was working in the United States Public Health Service in 1975, 76 as a statistician, epidemiologist, and he noticed and discovered information about the Tuskegee study. And he has passed on, but he was a strong, strong advocate for addressing the issue. Next slide, please. And in 1979, President Clinton and David Satcher, Dr. David Satcher, who was the president of Meharry Medical College, head of CDC, and then Surgeon General, when Dr. Satcher was serving as Surgeon General, he and President Clinton apologized for the Tuskegee study that affected Black males. Next slide, please. And this slide picks up on the other exploitations that have occurred to African Americans, influencing, of course, how they think today. Research was targeted towards young African Americans. We went through a phase where there was a rise of molecular bias. One was thinking that you could actually design drugs that were specific for African Americans, such as Bideal. And the last bullet, African American martyrs to lack of bioethics. And if we go to the next slide, please. Many of you are aware of Henrietta Lacks, who lived in Baltimore and was abused. And when it comes about ethics, she was not given the option of and provided permission for what was done to her. The book is fantastic. Rebecca Skloot writes very, very well. And if you have not read it, you should, and your children should read it as well. Next slide, please. Another incident that occurred in the 1900s, which affected the health of African Americans, as well as what they were able to do in terms of training future physicians, was a report that came out in 1910 called the Flexner Report. And in that report, there were seven Black medical schools in the United States. All but 2 were closed. So it went from 7 to 2. It affected not only, the Flexner report affected not only the number of African Americans who could be trained, but also women. And this was in 1910, and these were the 2 medical schools that survived. We now have 4, 2 came about in the last 25 years. Next slide, please. This is a headline that came from a recent newspaper. It says, being a person of color isn't a risk factor for coronavirus. Living in a racist country is. And that's very true. And in fact, there was a report that was published by the National Academy of Medicine in 2002. And this report highlighted unequal treatment by minorities, and particularly Blacks, by the medical community. Unequal treatment. This is a landmark study that was done between 2002 and 2004. And an example would be the next slide of unequal treatment. Cervical cancer, which Henrietta Lacks had, Black women today are dying of cervical cancer at a rate 41% higher than white women. Hispanic women have the highest incidence of cervical cancer with rates 40% higher than white women. This includes, in the term, of course, Hispanic, we're talking about women who are from Puerto Rico, as the mayor noted his roots, Mexico, Guatemala, etc. Next slide, please. Now, the second part of my comments will be on the current trends of COVID-19. But you can see from what has been noted so far that there are very valid reasons that a person might say, I'm not going to be involved in the medical community at all when it comes to any type of testing, because given the history of this nation, I don't want them testing on me. And I've heard that from many people, including my late wife, who was a vice president at 2 institutions, Dr. Linda Hare. And I once asked her, well, can you provide us just some control blood so that we can do some studies? And at that particular time, I think it was Vanderbilt. And she immediately shut me off, and she went like this and said, you're not going to do any experimentation on me. And this is the way she felt. And there was nothing that I could say to change her mind. And when she did this, I knew what my role was, and that was to walk away. Next slide, please. She and I would talk about it periodically, and she did begin to recognize the importance of participating in studies. So again, there are valid reasons why people are hesitant. This slide was unfortunately taken from CNN yesterday. You can see May 23rd, there were May 23rd, 2020, 100,000 people had died. And you can see yesterday, 500,000 people. Now we're past the 500,000 point. Next slide, please. This slide and the next slide are important. They're valuable. It shows that COVID-19 new cases are decreasing, 69% over the last 7-day moving average of new cases. You can see the 2 humps there. The first was in April. The second one was in July. And then you can see what happened after Thanksgiving and people getting together. And now we're going back down. So that's positive. Next slide. But note, but on the previous slide, even where we're going back down, we're still at a level that is comparable to last July. COVID hospitalizations are decreasing. Be interesting to know if that's true in Camden and South Jersey, or the number of hospitalizations at Cooper and other Lady of Lords, et cetera, are they decreasing? I should point out that I serve on the Cooper Medical School board. We actually have a board meeting on Thursday. And I've been on the medical school board since the medical school started. So periodically I come back to Camden and work with the people at the medical school, and it's a wonderful group of people. But you can see here hospitalizations are decreasing. Next slide, please. But again, and this is the topic of our discussion, Black, Hispanic, and Native Americans 4 times more likely to be hospitalized, nearly 3 times more likely to die. Next slide, please. So let's approach now vaccines. What are vaccines? What is being done, and what's in them? Next slide, please. So at the top of the slide, it shows January 2020, SARS-CoV-2 genome. That's the bases that make up the RNA virus SARS-CoV-2, which causes the disease COVID-19. In January of 2020, Chinese scientists published that. 10 months later, vaccines were ready to submit to the FDA for approval, November 2020. Now, anyone would say that is the fastest that any vaccine has ever been developed. And it is a valid question of what happened. How was it possible to develop these vaccines from Pfizer and Moderna so fast? And there are 3 points on the slide that help to explain. One is the technology, the molecular genetics, the molecular modeling. We were able to determine the sequence, the RNA sequence, and then to determine the structure of the virus and to begin to do work on that. with that biomedical information, biochemical information as well. The second is that the parallel processes occurred in terms of developing the vaccine, not sequential. In other words, phase 1, phase 2, phase 3. In the past, one would do phase 1 and then look to see what happened, phase 2, and then look to see what happened, and then do phase 3, and then produce the vaccine. Parallel process means when phase 1 showed some suggestion, Dr. Fauci and other people at NIH said, okay, let's do phase 2 while we're doing phase 1. Let's do phase 3 while we're doing the others. And let's actually go on and say to the company, make the vaccine. We'll pay for you to make the product. Maybe it won't work, but at least if it does, then we have something that really is beneficial. And that's what happened. So that's how it became really, really fast. And the third is there was a network set up for HIV vaccine trials. We still don't have a vaccine for HIV, but there were laboratories set up, there were infrastructure set up for how to develop vaccines. And when we had the problem with COVID-19, we shifted from the HIV vaccine trials network to the COVID-19 vaccine network. And that made it much faster. Next slide, please. This slide shows that on the left, on where it says A, you have the spike protein, which is on the surface of SARS-CoV-1. Now, those spikes that you see coming off of the virus and that Y symbol represents the site where the virus is going to bind to the human cell. Now, the key is that you want to prevent that lock from occurring. Anything that can prevent that lock from occurring will work. And the key for the development of these vaccines is an antibody that blocks that virus from coming in. You can see the kind of reddish structure there, and then the virus infection is blocked. That's the whole goal. So how do you get these antibodies? Next slide, please. We'll just focus on the number 3. There are 3 types of coronavirus vaccines in development. The bottom, the number 3, is what has happened with Moderna and Pfizer. And you can see that the messenger RNA, these are RNA viruses, the messenger RNA that codes for the spike protein was purified, put into a lipid capsule, and injected, and then the body produced the spike protein. It had the RNA. Well, one gave the RNA, so then the RNA was translated to protein. Next slide, please. So vaccines are required to achieve herd immunity. We need that. We need those vaccines. We need 80% of the population to be immune to the virus. The virus must be confirmed to work in vulnerable populations, including older people. 3, vaccines must be demonstrated to be safe. And then finally, vaccine trials must include participants from minority populations. And one of the questions that was raised during the registration was, how many minority people were involved in these trials? Next slide, please. So this slide is probably one of the most important slides. Please remember it and tell your friends. What is in Pfizer and Moderna vaccines? Very little. The modified mRNA to the spike protein. A mixture of charged and neutral lipids, including cholesterol, inorganic buffer salts, sucrose, and water. That's it. Note the bottom part of the slide. The vaccine does not contain preservatives, heavy metals, cellular products of animals, or microchips. If you're concerned about microchips, then you need to put down your phone, because you can be tracked forever with your phone. That's all that's in the vaccine. No fetal tissue, nothing like that. Next slide, please. Now these are the often, and it's a very, very important point, because you saw individuals wanted to make sure that we, minority individuals, are involved in the trials. And many years ago, that wasn't the case. But now it's a very important factor in vaccine trials. And one of the individuals that was involved in doing this was actually an African-American woman. But let's look at the racial ethnic distribution. On the left, Pfizer, BioNTech, that vaccine. 13% of the individuals were Hispanic, 10% were African-American, 6% were Asian, and 1% were Native Americans. So you can see there was a significant, adding the two together, it's 23%. It's not the percent of the population in the country, which is 13 and 18, which would be about 30, but it's getting there. And 45% were ages 56 to 85. For Moderna, the study that the vaccine that was developed at National Institutes of Health, you can see again the racial ethnic distribution. In this case, 20% were Hispanic, 10% were African American, and you can see the others. Now, one of the points, so we were represented. Now, one of the points that a friend of mine, Dr. James Hildreth, who's the president and CEO of Meharry Medical College, noted was he is actually on the board that makes these decisions. His point was, well, the percent African Americans was lower, 10%, but what he really wanted to see, and the mayor alluded to this earlier, he wanted to see, Dr. Hildreth, James Hildreth, wanted to see individuals, what were the results with individuals with conditions like diabetes, hypertension, regardless of the color. How did they fare? And there was a significant number of individuals in that trial. Next slide, please. Now, one other point about the vaccine, and we'll move on to the last point, and that is there are two injections that are necessary. The first injection, the first exposure, you have some memories cells that are developed, and you have antibody that is produced. But you can see after the second injection that the secondary response, there's a tremendous amount of IgG. And that's very important. Now we will see over time, through research, through science, whether only one injection is necessary. But right now, this is why you need both injections to really build up that secondary response, either 3 or 4 weeks later, depending on the vaccine. Next slide, please. Now, what are the side effects? It is very, very fair to raise the question of, is this safe? And we are continuing to do research to see what happens after a year, 5 years. We don't have that information now because you saw it was developed last year, January, November. The most common reactions include, I'm sure the mayor can attest, and other people who have either treated individuals or had the vaccine themselves. The most common reactions include injection site pain, headache, tiredness, and muscle aches, usually in the first 2 days and then resolving within a week after vaccination. And worldwide, more than 150 million people have received vaccine doses, and there's been little or no safety concerns. Next slide, please. So minorities are hesitant to get the vaccination. And you saw that only 5.4%. Next slide, please. So the final point I'm going to talk about is trust. And I've seen Dr. Jubril presentation, and thus I will, next slide, please, will not discuss this in detail because the Camden Coalition survey really touches on a lot of these points. Why this disparity in vaccination of people of color? Trust, fear, lack of transportation and convenient locations near home. So good to hear what the mayor said, and that is, we're going to be setting up these vaccination centers, but they're going to be in the neighborhood. So a person may not have to take a bus and then walk in order to get it. Next slide, please. Building trust, I will only mention bullet 1, which is in the survey, which we'll be discussing in a few minutes. And in order to build this trust, one of the best ways to do it is the target education, providing information with trusted messengers. It's a beautiful term, trusted messengers in language of the community, physicians, healthcare workers, ministers, politicians who have been in the community and their bases in the community, trusted messengers. Next slide, please. And in fact, on a national level, these are 4 people who are heavily involved in developing the vaccine. Let me just, Dr. Tyshaneka Corbett, she actually is one of the scientists that helped develop the RNA vaccine. She's brilliant. Google her, Dr. Corbett, C-O-R-B-E-T-T. Dr. Fuller, who's at Michigan, is on the FDA committee. Dr. Lisa Cooper is another brilliant person. She's involved in one of the clinical trials. She's at Hopkins. And Dr. Hildreth, and you've seen some of the slides say Meharry. He's the president and CEO of Meharry, and he's a virologist, and he's truly outstanding. He has an MD and a PhD, and he was a Rhodes Scholar at Oxford. And he's a down-to-earth Christian. I love him. Next slide, please. And one of the co-chair of the task force that President Biden has set up is Dr. Marcella Nunes-Smith, who's a professor at Yale. So you can see we were involved in making and we were involved and continue to be involved in making decisions on what happens to our people. Next slide, please. And there are Latinos and Native Americans also on the committee. Well, the last few slides, this slide makes the point that COVID kills. And on the right-hand side, that's the 500,000 that we pause to remember. And on the other side, that's 500,000 since February to February, 2020 to 2021. And look at the leading cause of death in 2019. 500,000. Heart disease was only 659,000. Cancer was 600,000. And now COVID is third. So look at the comparison with other diseases, and COVID basically kills. Next slide. So the bottom line, wear a mask, stay 6 feet apart, avoid crowds, avoid travel, airplanes, trains, wash your hands often, and when it's your turn, get vaccinated. And the next slide, please. There are a lot of trusted people in the community. Either your beautician or your barber often has information that I know some of us trust. And I went to the barber this morning and he said, I told him what I would be doing today. And he said, yes, there are valid reasons, but it is a different time now. And that's true. And we need to keep that in mind. And finally, this is a picture of me receiving my vaccine. Like the mayor and like a lot of you, I've had 2, the booster recently, and this was the Moderna vaccine. And it's something that we really, really must do. Last slide, please. This young lady is a physician at the University of Texas in Houston. And remind people, if they say, I don't trust vaccines, I don't trust COVID vaccine, look at her shirt. All those are vaccines against different diseases. Measles, varicella, meningococcus, etc. So please encourage individuals to be vaccinated. I look forward to comments in the chat, but we really have to take care of our people, and this is the time that we need to do it. Thank you very much.
Thank you so much, Dr. Hill. Thank you so much. You addressed so many key issues. I apologize, we're running a little behind on schedule, but the critical areas that Dr. Hill touched on were also we received a lot of questions ahead of time with those of you who registered ahead of time. So Dr. Hill just wanted to make sure that he touched on many of these questions that some of you had, that you had actually submitted prior to tonight's event that was submitted during registration. So thank you so much for that. We'll actually catch up on time after Dr. Jubril Oyeyemi's presentation. So with that being said, I would like to introduce, it's my pleasure to introduce Dr. Jubril Oyeyemi. Dr. Jubril is currently a hospitalist and associate medical director at Virtual's Memorial, Voorhees, and Marlton campuses. In 2017, he founded the Cherry Hill Free Clinic to provide care to the underserved population. In 2019, he was appointed medical director of Virtual's Community Health Institute and Camden Coalition of Healthcare Providers. Tonight, Dr. Jubril is going to present the results of a survey that was done by the Camden Coalition of Healthcare Providers, which actually surveyed the community residents to address, to basically gather information, gather data about their feelings about being vaccinated. So he's here tonight to actually give us those results. So we're looking forward to hearing it. Thank you, Dr. Jubril.
Yes, thank you so much, Dr. Saffold. I appreciate that. And Dr. Hill, I mean, you just hit it right on the head. You touched on just all the questions and concerns that we've heard from the community. And so what I want to share briefly with you all is the results of a survey that some of my colleagues at the Camden Coalition of Healthcare Providers worked on. And we did this survey last year when we started to, with everything we heard about, we saw with testing, with all of the challenges with testing, right? And realizing that access to testing wasn't as equitable as most of us might have liked at the outset. Things got better and things are better now, but realizing that we thought, you know what, let's, and anticipating that at some point in the future, the vaccine was going to be available, what's the community telling us? And so that was one of the major drivers for the survey. And couple that with the fact that in the state of New Jersey, right, adult vaccination rates tend to be lower than the national average, right? And we were also hearing things from providers in the community, doctors, nurses, nurse practitioners, and the rest of the medical staff that vaccine confidence is an issue, which is what Dr. Hill addressed with us tonight. And also the fact that some of the providers weren't quite sure they had the tools to have this conversation, right? And I love how Dr. Hill sort of brought it on from the historical background, because you'll find that a lot of questions that a lot of community members have about the vaccine it's actually rooted in what's happened historically, right? So when we get those questions about fertility, is the COVID vaccine going to affect my fertility? Are you experimenting on me? Are there Black and Hispanic folk in the studies? These are questions rooted in history, right? And so some providers were not comfortable that they had the tools to actually address this, right? And then there's the misinformation, which Dr. Hill nicely touched on, right? So the survey that was done was, sort of this was great work by the team at the Camden Coalition of Healthcare Providers. My colleague Natasha and Janelle worked on this, right? So it was an interview style format of the survey, right, where we had both qualitative and quantitative questions, right? The population was 18 and up, we were able to leverage sort of the presence and the sort of the convenient work of the Camden Coalition, where we've got multiple partners in the community, from health systems to primary care offices to community-based organizations to faith-based organizations. We're able to leverage that in this survey, right? And what Dr. Hill talked about earlier, which is beyond just getting numbers, right? Is the folks in that survey, are they folks who have chronic medical conditions? Are they hypertensive, diabetic? Because we want to hear what this vulnerable cohort has to say about the vaccine. And then we were also able to compare the community's thoughts about the vaccine to thoughts about the flu, the pneumonia, and all the other previous vaccines. So 265 surveys in total. So not to be ignored in any way. That's almost 300, right? It sort of went through from October through December, right? With the average age being about 50 years old of our respondents, right? And about half of the 265 being women, just under half being men, and less than 5% identified as non-binary, trans, and sort of gender fluid. 33% of the respondents were Black, another 33% were Hispanic, and about 25% were white. And about 5% or so were Asian, American Indian, and multiracial, right? And so the results from it, which is not going to be surprising to a lot of us, right, is that about 2/3, so about 2 out of every 3 said they were extremely unlikely to receive the flu vaccine. So we know there's already some baseline confidence or lack thereof, really, or distrust in vaccinations, period, right? And about half of the 265 said they were extremely unlikely to receive the COVID-19 vaccine, right? Now, this was, again, October through December, right? The other thing we found here was that compared to the national surveys, right, we found that folks that responded in this particular, in our local survey, they were less likely to want to receive the vaccine compared to the rest of the nation. And so this is important to know, right? The other findings here with that, folks in the study who were in the survey who were Black were less likely to want to receive the vaccine. Women were less likely to want to receive the vaccine, and folks who were highly vulnerable, struggling with housing instability. That number was about 20 of the 265, but those folks were also less likely to want to receive the vaccine. So one of the things we learned from the respondents was, well, what are people concerned about? And I think some of those things Dr. Hill has touched on tonight for us, right? Folks were concerned about not knowing enough about the vaccine, right? Which is nicely cleared for us tonight, right? There were general safety concerns, right? Questions about where was it rushed? This happened in 10 months. Other vaccines take years, right? And then the third point, which was questions about testing, about just lack of testing of the new vaccine. Again, going back to I think that's sort of somewhat similar to number 2. And then what the folks in the survey sort of said to us was, well, here are the 3 things that could boost their confidence about it. And I think number 1 has been really accomplished tonight, which is education, better education about the vaccine, right? Discussion with your medical providers. I think this is key. I think one of the things I've said to a lot of my patients in the city is, listen, ignore what you're hearing on what you're seeing on WhatsApp, TikTok, Facebook, right? You want to talk to your providers, your medical provider, your primary care doctor, your nurse practitioner, your physician assistant, your nurses. You want to get information from those sources, right? And then number 3 was people said, just fear of contracting the virus, because as Dr. Hill said, a lot of us either know folks who have caught the virus, right? And really, a lot of us know folks who have passed away from the virus. I know folks in my family, who have passed away from it. So that's, and I think we all, most of us share that, unfortunately. And the other thing we learned from the respondents here was that the vast majority of folks, right, and this is good, indicated that their most trusted source was their doctors, nurse practitioners, physician assistants, and nurses. And so, and that's good. That's good to know. And so the next point here, which is the provider survey, and this is, I believe, my last slide, right, is that and this is key to note for our healthcare systems, for Cooper, Virtua, Jefferson, and Spira, right, is that out of the 150 physicians, nurses, MAs, and community health workers that we surveyed, 80% said they had not got training. They had not received training on how to address this hesitancy. So I think we've got to share Dr. Hill's presentation tonight, because you have to come from a place of when you understand the historical setting to it, right? You approach it with empathy. You understand that, no, this is not the anti-vaxxer movement. These are folks in the community who are concerned for justifiable reasons. And then number 2, there was only about 16% of these 156 clinicians said that their workplace had a workflow for addressing vaccine hesitancy, right? And so we've got to do better. The healthcare system, we have to do better. And about 2/3, we're likely to, or very likely to, to engage in these conversations, right? We've got 100+ people on this call tonight, and I'm excited about that because those are 100 ambassadors that could help sort of disseminate this remarkable message that Dr. Hill has taken time to prepare for us. So, and that is it. That is it. I think a lot learned from that. I will turn it back over to Dr. Saffold. Thank you so much for the opportunity.
Thank you, Dr. Jubril. Thank you so much. And again, same as with Dr. Hill, I appreciate that you actually answer many of the questions that have already been presented with as everyone was registering, they presented questions, as I said before. So thank you so much for making an intentional effort to address some of the concerns that people had. And one of the questions you really addressed and made sure you drove home was the providers. What is it that they can actually do in order to make people feel more comfortable about taking a vaccine? Now, for sake of time, originally we were scheduled for myself, Dr. Jubril, and Dr. Hill to have a conversation about our opinions on things, just an open conversation. But because of sake of time, I think it's more important to make sure we answer the questions that you put forth, and also allow for any questions in the chat box to be addressed. Because again, we want to make sure that we are hearing from you, the community members, and this is about you, the community members. So Dr. Jubril, myself, and Dr. Hill, we could talk later, we could talk offline and have great conversations and invite you all at a later time. But for right now, let's make sure we keep track of time. One of the I thought was really stood out for me, one of the questions was, and this was actually sent in by, excuse me, I deeply apologize if I mispronounce your name, but this is a Rutgers student who submitted the question. Jubril Oyeyemi is the student's name. If the COVID vaccine is similar to the flu vaccine in that it doesn't 100% prevent you from getting it, why should a Black individual trust that the vaccine is safe for them or even necessary, in spite of fears that may exist from past medical injustices? I think that is a great question. If it's not 100% effective, why do it?
Well, I think one of the things, and Dr. Jubril, please share, but I think you would probably agree with the first thing I will say. There is absolutely nothing that is 100% in this. I mean, come on, your partner isn't, you're not guaranteed to have your partner 100%. Well, you hope you will, but nevertheless. But seriously, there's nothing that's 100%. And in fact, these two vaccines are 95% in terms of developing a severe disease. Well, we were hoping at the beginning that if it were 60 or 70%, we'd be jumping for joy.
Yes,
So
absolutely.
now we have, right, Dr. Jubril? Now we have
Yes, sir.
something that's 95%. That's very good.
Yeah.
But the questioner is asking a very valid point, and making a very valid point in that it's not 100%. The flu vaccine is less, and the flu vaccine you take every year after we quote unquote learn about the previous year. So we end up with sometimes guessing it right, and it's maybe 70, 80, and a couple of years ago, it was not very effective at all. So biology and science are continue to move to try and resolve questions like what you ask, but 70%, 95% certainly is better than 0%. And we just need to recognize, as the questioner, as a student rightly asked, the historical situations and the dangers that were done and the way we were utilized very negatively. When you go back and read some of the literature or just read Dr. Washington's book, it's just tragic. But we have to try and set that aside and go for the 70, go for the 90, and do our best. Your thoughts, Dr. Jubril?
Yeah, Dr. Haley, that was spot on. The only point I have to add to that is that see, we can't afford the alternative. We really can't, right? So we've heard about the 500,000 people that have died as a result of the infection, right? And I treat, I see a lot of young people, 30s, 40s, who caught the infection, who survived the infection, thankfully, right? But now they've got debilitating, blood clots, chronic fatigue, palpitations. Like, these are people who were functional, who were, I got the one gentleman, he's an instructor he teaches Brazilian Jiu-Jitsu, pre-COVID, post-COVID, can't do that anymore, right? And so, and what grabs your attention is that in some studies, about 2 out of every 6 infections, people will develop these longer course, unexplained in some cases, constellation of symptoms, whether that's like the fatigue, the palpitations, right? So what I argue is, in addition to what Dr. Hill just educated us about, what I argue is that we can't afford the alternative. I don't want you to take that risk of, okay, I'm just gonna wing it. I'm just gonna hope I don't get infected. And if I do, I'm gonna hope I'm that 4 out of 6 people that's not gonna have a long-term complication from it, right? When we know, or we've come to learn that the vaccine, the efficacy of it, the 95% Dr. Hill talked about, and the safety of it, that 150 million people, almost 200 million people worldwide have received the vaccine, and it's overwhelmingly safe. So the argument for it is a lot on a scale of to get it, to do or not to. It's so much higher on the, getting it done and getting vaccinated and protected.
Thank you so much for that. And I definitely agree. And that's one of the things that I make sure when I'm speaking with family members and friends, is that you honestly are taking a gamble not getting it, more so than getting it, because again, people become very ill, young, elder, but it's not just the older, it's the younger. And people will say, oh, it's fine, people survived. But again, Dr. Jubril, you hit the nail on the head. People are surviving, but we don't discuss and talk about the lasting effects from having it. And those can actually be life-changing. People are, and unfortunately, you see people posting on social media and they'll say, oh, I feel better, I had it, I'm okay now. You don't really know their true story. Unfortunately, we really don't know how this will affect their health years from now. Right. We honestly don't know. So that is one of the reasons why, too, we say that. And this quick point, too, I wanted to make is that, again, Dr. Hill, you really did basically give a good picture of how many Black and Brown members of the community are being vaccinated in comparison to our white groups. And it is very disturbing because, again, your next slide was about how many deaths of the Black and Brown community. If we do not increase the vaccinations, there will not be a Black and Brown community left, right? Because again, it's the opposite of what happened with Tuskegee. It's more so like we need to become vaccinated to protect ourselves because we're affected at a higher rate and we're also dying at a higher rate. So that is a key issue. A community member, Joyce Drayton, asked the question, how can we prevent the poor rollout to Black communities for the vaccine from happening again? Which I think is an interesting question, because remember, we're seeing on media, Black and Brown don't want the vaccine, but I beg to differ. There are many members of the Black and Brown community that would like to get the vaccine and they don't have access to it because you have people that have more social capital, more economic capital that are coming into underserved populations and taking the appointments. Would you like to address that? I'm sorry, Dr. Hill, you're muted. Can he be unmuted, please?
Thank you. Sorry. What you said is absolutely true. I think it was in the Bronx recently, a community group had found a location where they could work with individuals in the community to have them come in and be vaccinated.
Mm-hmm.
And they noticed two things. One is that a lot of the people who came in were white. And they asked the gentleman, how did he know these people were not from the community? And he said two things. One is that they were white. And then second, they looked surprised. In other words, and I'm sure the brother was being gentle with Dr. Jubril, you know what I'm talking. They looked surprised. How do I get out of here? You know. And then in another situation in Florida, there were people who were dressed as older individuals, disguised, and they got the first vaccine as they was doing that, and then the second they were caught. So you pointed out absolutely correctly that access at the beginning was really, really difficult. And listening to some of the committee meetings, which are public, they pointed out, Dr. Fauci pointed out a couple of days ago, Tony said that they were going to do a couple of things. One is have mobile testing centers where people would be able to go in the rural areas or into neighborhoods to increase access. But the initial rollout was it was not equitable. There's no question about that.
Mm-hmm. Yeah, absolutely. Dr. Jubril, did you want to comment on that?
You know, I was just going to say that Mayor Moran and what Dr. Hill also said, right, kind of hit the nail on the head, which is that we are going to need trusted ambassadors, right, from the community, medical professionals, clergy, our clergy, right, to just, and it's going to take going block to block, door to door, making sure that access is there, not just book an appointment online, right? But making that access, equitable, and realizing that there are folks like my parents, right, who are not going to go online. They're not doing that for nothing, right? So we need to make, and I think some of the mega sites around us, like for example, the virtual site, which unfortunately is not in the city, is all the way in Burlington County, but it's one of the sites where you can call and make an appointment when when that's available. But right now, it's not I say that the conversation right now is actually evolved from vaccine confidence to there's just no supply can't even meet the demand right now. The demand for the vaccine is so high, even in our community right now, that's gotta, where are these 200 million doses that the government has secured? So these are all the things that affect what's the access to the vaccines right now. But I think there's actually more people in the community that want it right now.
Yeah, and I think too, and the question, going back to the question, the original question of the rollout, I think everything is a learning experience. We haven't had a pandemic in many, many years. And then also, how things are handled is also driven by the political bodies at the time. So unfortunately, we would love to, we have great frameworks that have shown to work in the past. They were not necessarily followed, but who is to say that if unfortunately we experience this in another 20, 40, 100 years, we don't really know. But what we can do is figure out how we're going to fix it and work together as a community to do everything we can, which is why it's so important for Rutgers School of Nursing Camden to join with Mayor Moran and Dr. Hill and Dr. Jubril to come together and really work with the community partners and figure out how we are going to, as community members, how we are going to address these initiatives and make the rollout better. That's what it's all about. We can't grump on it and say, well, this wasn't done correctly. All we could do is learn from it and develop maybe our own model to maybe follow separate from the federal model, and then actually be able to make sure we tailor it to fit our community members. Another interesting question. Oh, go ahead. I'm sorry.
Can I just make a very quick point? And that is, as you know, right down the street over on Broadway, 401 Broadway, it's Cooper Medical School of Rowan University. The dean, Dean Annette Riboli, is a tremendous leader. And she has some of the exact same concerns about the health of Camden in a very broad scale. In fact, the motto of Cooper Medical School is Camden is our classroom, Camden is our home. So when you continue to think of partners, don't hesitate. And I know there are activities that involve Dean Riboli and Dean Mitchell-Williams and others. They really are truly committed to this effort.
As well as the Department of Health. I was in a meeting with the Department of Health Camden County Department of Health has been wonderful. They are working really hard to partner with everyone to address, and they also are very aware of the lack of availability in underserved populations, and they really are working on best models to address the issue. And we're going to wrap up in a few minutes, but this was a question presented from Dr. Maria O'Toole from the School of Nursing Camden. What can healthcare professionals do to assure Black communities that the healthcare systems will be proactive in protecting their rights rather than reactive when a breach of ethics come to light? Do you think that adequate safeguards are now in place? And I think that is a critical question for us to answer tonight. Is it that we have already put safeguards in place to address and make sure that harm does not come to members of the Black community, building that trust and basically saying that if there is some dishonesty, something that happens, that we're not just going to say, oh, sorry, it happened again, forgive us, right? What is it that, can you guys speak to what safeguards have been put in place and really help people understand that things that were done with the Tuskegee experiment and others, that we have a lot of safeguards in place currently to prevent those things from happening to vulnerable populations?
Well, I think the questionnaire and the results that Dr. Jubril so eloquently presented really tell us that the answer to that question is no. If 80% of the healthcare providers are not being educated or aware of the causes of vaccine hesitancy, then that can lead to a wide range of problems that Dr. Jubril, I'm sure, has seen. Well, why don't they come? I mean, and it's available. If they don't come, it's their fault.
Mhm.
And I think developing, one has to have the mindset that, number one, that is a real problem, 8 out of 10. When I read that and saw it, Dr. Jubril, I was really shocked. I mean, how are these people being educated? What's in their curriculum?
Mhm.
Do they have people like Dr. Jubril, who's invited in to give a lecture and talk about the causes and the reasons for vaccine hesitancy? I mean, we also all have conscious and unconscious biases. In the curriculum. Is that being discussed? Is it being discussed? You're mentioning public health, working with public health. Are they aware of unconscious biases that exist? We all have them. And conscious biases sometimes as well. So I think that that's a key question, and it's something that we just have to address. But it's a very broad, very broad issue.
Mhm. Yeah. Dr. Jubril, would you like to comment on that?
Yeah, thank you so much, Dr. Saffold and Dr. Hill for that. You know, that survey was so eye-opening for me that when I saw it, my health system that I represent, Virtual Health, right? We actually pulled the team together that's facing the community, that's community facing with the mobile farmers market and the mobile grocery store. We pulled everyone together, and I actually did a presentation similar to what Dr. Hill just educated us on tonight on the title of it, the topic of it was structural racism in medicine, right? And I sort of went through from 1619 to date, some of those injustices, right? And the reason we did that was to try to educate some of our providers who were on that listen, what you're seeing manifesting as vaccine distrust, right? That lack of confidence is rooted in all those things that's happened, you know, from you know, the OBGYN experimenting on Black women, right? You know, the father of OBGYN doing that without anesthesia, right? To what used to be resurrectionists who used to steal Black bodies in the cemeteries for cadavers for medical students, to Tuskegee, to Henrietta Lacks, the forced sterilization, all those things is what is culminated in the lack of trust in the medical establishment. So, you know, but it will take, and I'm sure Cooper is doing something similar, right? It will take our health systems educating our clinicians of the history behind this, right? And on top of that, right, the things that are in place to make sure a Tuskegee doesn't happen again, right? For research studies today to happen anywhere in whatever institution you look at, there's what's deemed what we call an IRB, an institutional review board, that reviews the study to make sure that, you know, that whoever is designing the study isn't doing something crazy, right? Like giving some people medicine and not giving others, you know, for standard of care. So there's an IRB that's been established in every institution, and this is an independent body that reviews whatever studies are to be done. Dr. Hill talked earlier about his colleagues serving, you know, on the advisory board for vaccination. So the CDC put together something called the ACIP, right, Advisory Committee, right, on vaccination practices, right? And the point of those, and these are not, this is a group of people who are not paid by the drug companies, by Pfizer or Moderna. These are independent folks who are reviewing whatever study and making sure that it is equitable. So all these things have been put in place to make sure that we never have a Tuskegee happen again, that we never have, you know, a situation with Henrietta Lacks where her cells were stolen from her without her consent. So I hope that helps.
Yes, thank you so much. That is an excellent response to that. And thank you for addressing Dr. Hill and Dr. Hill, because this actually addressed the question presented by Dean Donna Nikitas from Rutgers Camden School of Nursing. Her question and comment was, we have the ability to address structural racism within our society. What recommendations can you suggest to faculty and nursing students and to her as well to promote greater trust so that our Camden community view us as a reliable source of information? And I think both of you hit the nail on the head, even ourselves addressing our own biases and making sure that we make people feel comfortable, being honest, being loyal, and basically establishing these relationships and also making ourselves available so that people can feel comfortable enough and they have access to us to access these questions. And really quickly before we wrap up, I wanted to make sure that we address a student alumni of Rutgers Camden asked the question, Natalie Weeks. Many senior members of the Black and Brown communities do not know how to access the internet to sign on to a COVID vaccination location. Will there soon be additional assistance or program to help? I'll answer that one. I'm in a meeting with a representative from the Camden County Department of Health. Absolutely. This is an issue that they are aware of, and they are working on developing a response to that issue. So hopefully we'll hear something in the next week or two. Mayor Moran also spoke on that. We are really trying to address all members of the community because I have said this many times. Again, on media, you hear Black and Brown members of the Black and Brown community do not want to get vaccinated. It's not necessarily that is the case. It's that the numbers are so low because we have such lack of access. So I am excited and looking forward to the moment that we actually have enough vaccines available in underserved populations. It's easy for people to walk to. They could get, vaccinated down the street from their homes without these long lines and all of these other things. I am looking forward to the Black and Brown community signing up and actually coming to get the vaccine so that we can start to develop herd immunity in these areas. That's going to be critically important. And someone, Tanisha Bass, who is, faculty or staff from Rutgers Camden, should someone get the vaccine if they are at high risk with diabetes at the age of 64, but also suffers from severe allergies to the point where they normally cannot get the regular flu vaccine? Does either one of you want to address? I would say that they could consult with their primary care physician, but I welcome you to add another response to that.
I don't think there is another response.
So Dr. Hill, you agree with that response? Okay, all right.
I think that's very, very important to check with your physician. There may be, as Dr. Jubril, I'm sure knows, underlying conditions that would preclude, but speaking with her primary care physician would be very, very important.
Yes, for sure. And then lastly, Ashley Mims, who's an alumni of Rutgers Camden, what suggestions can you offer to encourage young adults to be open to get the vaccines? And I am hearing this, many people that I've been in contact with, family and friends, they are like, nope, not doing it. But they are asking for assistance to help set up their parents and their grandparents to get the vaccine. So what is it that we can do to help encourage younger populations to get vaccinated? Other than disconnect all social media with that has any misinformation, correct? But other than that, what is it that you think we could do?
I've noticed that there is an increase, this is anecdotal, there seems to be an increase in young people recognizing how serious this is. Mm-hmm. And I think a lot of it, and Dr. Jubril, I certainly would appreciate your comment as well. I think initially, a lot of the hesitancy some of the hesitancy, particularly from young people like you're describing, was from misinformation. Mm-hmm. Dr. Fauci made a point this morning that someone asked him, could things have been different? Could we have not lost 500,000 if the message had been less political and more medical? And he said, yes, that's obvious. Mm-hmm. I mean, the die was cast for political reasons in an election year. And so young people just picked up on some of the messages that were out there. And then they, of course, went to social media, which is not really the best place to get your medical advice from somebody that you're chatting with over social media. But I think continued accurate information. I've known young people who have said, I'm not going to do it right now, but continued accurate information and seeing the results of those who have taken it as well as those who have not shakes them up.
Yeah, I agree. Dr. Jubril, did you want to make a comment or addition to that before we close for the evening?
Yeah, just one quick one, which is that exactly what Dr. Hill said, and thank you for that, which is that your source of information, making sure it's your providers, providers who spent time in years, doing this and who looked into it. But also, I think some young people also find solace in the fact that, just knowing that to date, because there's now the camp of, I'm gonna watch and wait. I just want to watch and wait. Give it time, right? I want to give it 6 months, right? And when they find out that over 50 million people in the U.S. alone have received the vaccine, with an overwhelming safety data, right? I think people feel comfortable that, okay, I think this is safe, right? And in worldwide, almost 200 million people have received the vaccine so far and have done okay and are now protected. That's also sort of encouraging. And so, I think at the end of the day, and the reason I'm so grateful that Rutgers, put this together, and we've all now been educated. I would love to just disseminate this with Dr. Hill's presentation to really everyone that can get it to see it. But then the goal of it is just to get the information to you, right? If you then decide that I'd rather wait, then you know what, I respect that, right? But let's make sure you've got the right information. Let's debunk all that. Let's unpack the vaccine, tell you what's in it. When you know what's in it, then you feel more comfortable.
Yes, thank you so much for that. And let me say again, it was a great conversation, great night. Thank you so much for all staying on. I deeply apologize for going over in time, but as you can see, we are very passionate about addressing your questions, your concerns, and really getting out correct information, because I think that's critically important. And we really do ask that you share the information you learned tonight with your friends and family members. And then again, Dr. Jubril, really, that's all that needs to be said, is basically, please make sure that you are doing due diligence and researching and getting correct information, information that you can actually pass on to others to help explain some of the issues that we have. I want to also say that those of you who are having difficulty signing up to be vaccinated, please just be patient. Don't give up. Please don't look at it as we really don't care about you or we're not trying to make it available. And I said it to say, because I know that the Department of Health is working really hard to make sure that they bring the vaccine and make it a lot easier for you to sign up and have access to vaccination sites. So again, I don't want you to get discouraged and decide, oh, I'm not going to get it because it's too hard, but basically reach out to your community partnerships, your providers to help you get set up. And I'm sure there also will be some volunteer services coming down the pipeline to help people learn how to get signed up, which will be very important. So again, thank you all for actually staying on with us tonight. We are over 30 minutes past time. So I appreciate all of you staying on. Thank you, Dr. Hill and Dr. Jabril. Yep, Dr. Hill.
I just want to say thank you to you, Dr. Saffold.
Oh, thank you.
Thank you, Dr. Jabril.
Thank you, sir. Thank
you. You are young people who can really be very effective in telling individuals in your community and sharing the accurate information. And I really wish you well in terms of your careers. You're the type of people that we need. We really, really do. Then finally, Mayor, there are a lot of commitments that I'm sure you have on a regular basis. For you to be present and to listen and to participate in this discussion really shows that you are concerned about the health of Camden. And I thank you, and I'm sure a lot of people who were on the call thank you, and also people who you will never ever know thank you, because they recognize that you have a heartfelt commitment. Your roots are probably as humble as others, and you're in it for the purpose of making sure that Camden continues to thrive. So thank you for all that you have done and continue to do for Camden. I do hope, however, that Woodrow Wilson never wins another football game against Camden. I just had to share that with you.
You know, these Camden High folks always got to get the last plug in, and it's always that way. But let me say this, Dr. Saffold, thank you for your leadership in Rutgers and the nursing school. Dr. Jubril, thank you for all that you do with the coalition. And
thank you, sir.
Dr. Hill, what an honor to sit and listen to you and feel that you know, you're a Camden individual that has really made big things happen, and what we're going to continue to stay focused on is preaching social distancing, self-hygiene, and social distancing, and wearing your mask. But more importantly, we're going to be working with all of our clergy to encourage their congregations to get their folks vaccinated, and that's going to be the conduit. So once again, thank you to all of Rutgers, and thank you.
Yes.
God bless
Absolutely.
you.
Thank you guys for a great night. And Dr. Hill, thank you for paving the way for Black and Brown members to know that we can accomplish things and actually follow in your footsteps. So thank you so much for that.
Yes,
so thank you guys.
I second that. Thank
Yes,
you, Dr. Hill.
Yes,
You're
absolutely.
Take
Yes.
care.
Yes,
night,
thank you guys so much. Have a wonderful night. Thank you. We'll do it again. Thank you so much.
Take care.
Thank you.